Sexually transmitted diseases, or STDs, are far more common than most people realize. In the United States alone, the CDC reports that 1 in 5 people has an STD at any given time. In Europe, infections like chlamydia, gonorrhea, and syphilis are rising every year. Yet most people don't know they have an STD, because many infections show no symptoms at all. So the big question is, how do you actually know if you have an STD? Today, I'm going to give you a medically accurate, USA-Europe-focused guide that explains the top symptoms of common signs you should never ignore, silent infections that show 0 symptoms, when to get tested, how doctors diagnose how you can protect yourself, and what to do if you think you might already be infected. Let's begin. Number 1. Why STDs are so hard to detect. One of the biggest reasons STDs spread quickly is because most people never notice symptoms. Infections like chlamydia, gonorrhea, HPV, HIV early stage often remain silent for weeks, months, or years. In both the USA and Europe, more than 50% of STD infections are discovered accidentally during routine. This means you cannot rely on symptoms alone. The only accurate way to know is by testing. Still, many infections do show warning signs. Let's talk about them. Number 2. The most common STD symptoms in men and women. If you notice any of these signs, get tested right away. A. Pain or burning during urination. A burning sensation while urinating is one of the most common symptoms of gonorrhea, chlamydia, herpes sometimes. This symptom appears because the infection irritates the urethra, the tube through which urine leaves the body. If you experience this for more than 24 to 48 hours, you should be tested. B. Unusual vaginal or penile discharge. Healthy discharge is usually clear or white, but unusual discharge can indicate an signs to watch. Women, yellow, green, or gray discharge, strong or foul smell, sudden increase in discharge, frothy or bubbly texture. Men, thick white or yellow pus, sticky discharge, discharge appearing after waking up. These are classic signs of gonorrhea, chlamydia. C. Genital itching or burning. Persistent itching around the vagina, the penis, the anus may indicate herpes, pubic lice, yeast infection, not an STD, but similar symptoms. If itching continues for more than a few days, get checked. D. Genital bumps, blisters, or sores. This is a major red flag. Painful blisters equals herpes. Herpes sores look like small, painful bumps. Blisters filled with fluid. Red ulcers after bursting. Painless hard sores equals syphilis. A syphilis sore, called a chancre, is painless, appears alone, looks like a small crater or cut, usually appears on genitals, mouth, or anus. This is extremely infectious. E. Lower abdominal pain or pelvic pain. Women may experience cramping, heavy pelvic pressure, pain during sex, back pain. This may be caused by chlamydia, gonorrhea, pelvic inflammatory disease. Untreated infections can lead to infertility. F. Testicular pain or swelling men. This can occur due to chlamydia, gonorrhea. If you experience sudden testicular pain, get urgent medical help. G. Bleeding between periods. Women. Irregular bleeding or spotting can be a sign of chlamydia, gonorrhea, cervical infection. H. Flu-like symptoms. If you experience fever, fatigue, sore throat, body pain, swollen glands. This may indicate HIV early stage, herpes outbreak, syphilis secondary stage. Number 3, STDs that show NO symptoms. Some STDs remain completely silent. That's why routine testing is necessary. Silent STDs include chlamydia, HPV, HIV for years, hepatitis B and C, trichomoniasis. These infections can damage your health silently. In the USA and Europe, doctors recommend annual STD testing if you are sexually active, even if you have no symptoms. Number 4, who should get tested? Doctors recommend STD testing if you had unprotected sex, you have multiple partners, your partner has symptoms, you notice genital discharge, you've never been tested, you recently ended or started a new relationship, you are pregnant, you are under 25 and sexually active. USA and Europe guidelines. Testing is simple, painless, and fast. Number 5. How doctors test for STDs. Different STDs require different tests. Blood tests, HIV, syphilis, hepatitis, urine tests, gonorrhea, chlamydia, swab tests, vaginal swab, throat swab, rectal swab, urethral swab, rarely used now, pap smear, women only. Detects HPV-related cervical changes. Testing usually takes 5 to 10 minutes, and results may come in 1 to 3 days. Number 6. What happens if you leave an STD untreated? Untreated STDs can lead to serious complications. Women, infertility, pelvic inflammatory disease, chronic pelvic pain, ectopic pregnancy, cervical cancer, HPV, men, infertility, prostate inflammation, testicular damage, chronic urethral infection. Both. HIV risk increases, organ damage, syphilis, liver disease, hepatitis. Early treatment prevents almost all complications. Number 7. Best treatments for common STDs. Most STDs are treatable. Some are curable. Curable STDs. Chlamydia gives antibiotics. Gonorrhea gives antibiotics. Syphilis gives penicillin injection. Trichomoniasis gives oral medication. Not curable, but manageable. HIV. Herpes. Early treatment greatly reduces complications. Number 8. How to protect yourself from STDs. A. Use condoms every time. Condoms reduce STD risk by 98% when used correctly. B. Get tested routinely. At least once every year, or every 3 to 6 months if you have new partners. C. Avoid sharing needles. Prevents HIV and hepatitis. D. Get vaccinated. HPV vaccine. Hepatitis B vaccine. E. Choose partners carefully. Ask about STD status and testing history. Final message. STDs are extremely common, but they are also extremely treatable and preventable. If you notice any symptoms mentioned in this video, or even if you feel unsure, get tested as soon as possible. Your health, your future, and your relationships depend on it. And remember, for more important health advice like this, make sure to subscribe to the channel.